get them? We get these AGEs by cooking in high temperature. And we inhibit them by cooking with moisture. So I tell all my patients, boil for a few minutes when you can, poach when you can, buy a steamer. A bamboo steamer is a perfect way to go. Because the more we fry, broil, and I know no one's going to deep fry here, and the more we roast, so fry, broil, and roast, we increase the AGEs in our food. Let's take a look at 3 ounces of chicken. If we oven fry it, it has 9,000 AGEs. If we boil it, it's 1,000. And if we roast it, it's about 4,000 or so, half the amount of oven fried. So in conclusion, there are 4 things I want you to remember. First, whole foods, mainly vegetables, grains, and legumes. Lean protein, preferably from the earth. Healthy forms of fat, olive oil, nuts, seeds, pumpkin, and flax. And last but not least, how you cook a food can affect its nutrition content. In the previous lecture, we discussed that not all foods are created equally. We concluded again that food matters and that nutrition is a key component to our health. As we have already seen, the foods that we eat can lead to or prevent inflammation. And inflammation is one of the final common pathways for most of the diseases that I see every day in my practice. So the first question is, what is inflammation? And is it all bad? Well, it's not all bad, because inflammation is our body's normal response to an injury, a normal response to infection, to stress, to foreign substances, and anything that might be irritating us. So, for example, in medicine, we use the term itis to mean inflammation. We say hepatitis, pharyngitis, inflammation of the throat, or sore throat. So when we have inflammation, we have swelling, we have redness, we have pain, we have warmth. These are the classic signs of inflammation. The body is turning on its defense mechanism to defend against some sort of toxin, or in the case of a pharyngitis, a foreign invader, as we say. It is a crucial protective reaction. It's there to protect us so that healing can take place. But what if you have a chronic illness? What happens if you have inflammation in your gums, around your teeth? Here comes the itis again, gingivitis. What if you are under a lot of stress? Your body is constantly being exposed to what's called inflammatory cytokines. If you have inflammation in your gums, your body is constantly trying to fight that inflammation. So how do I see it in my practice? People come in to see me and they say, hey, Dr. G, my joints hurt. I have shoulder pain. I have elbow pain, knee pain. They may have ulcers. They may have a classic form of inflammation called emphysema or asthma, irritation of the lung. They may have eczema, psoriasis, skin rashes. I also see, of course, heart disease and inflammation of the colon, something called colitis. I also see the end result of inflammation. We see things like cancer now linked to inflammation, Alzheimer's disease, and as you will hear me talk about throughout these lectures, heart disease. As a matter of fact, most cardiologists today are less worried about cholesterol as it relates to blockage in the arteries than worried about inflammation. Inflammation is more important. So today we will review some of the causes of chronic inflammation. But what's even more important, when we leave this lecture, we will know what we can do to put the fire out. How can we reverse the process? If we can get to the underlying cause, as we've said in the beginning, we can reverse the inflammation and prevent it in the first place. So, what causes chronic inflammation? Well, one that you might not think about is polluted air, or chemical irritants, particles in the air, secondhand smoke, pesticides. All of these the body sees again as foreign invaders. They turn on our immune system. They are foreign particles that the body is responding to. This irritation can lead to chronic inflammation of the lung. I've already mentioned asthma. Possibly other parts of the body will be affected as well. And yes, it can even increase the risk of cancer. I'd like to take a minute to talk about one other common cause that most people don't think about. We're all used to having an infection and taking an antibiotic and the bacteria gets cleared and we feel better. But what about chronic infections? We actually know that ulcers, peptic ulcer disease, is caused by a bacteria. It's called Helicobacter pylori. This bacteria sits in our stomach, produces inflammation, can cause ulcers, and can even cause stomach cancer. So if someone has Helicobacter pylori, you don't say, oh, let's just give you antacids. You want to treat the Helicobacter. One of the things that I see in my practice is people come in with lab results that are showing inflammation. And no one has bothered to check them for inflammation of the gums, what we call gingivitis. No one has bothered to question them about their stomach. Maybe it's this Helicobacter. And one of my favorites is food sensitivity. Being sensitive or allergic to a food is so important that it is a topic all to itself in another lecture. But if we have a sensitivity or an allergy to a food, that sets up an inflammatory response. There is a difference between sensitivity and allergy, and we will be reviewing this throughout a few lectures. But just to make it really simple, an allergy is a quick reaction. I'm allergic to peanuts. I eat a peanut and I may not be able to breathe. My body may swell up. I might get what we call edema. The immune response is that we produce a protein called IgE. The way I teach it to my patients, I say, remember, IgE, the E is for emergency. That's what happens with an allergy. But what happens with a food sensitivity? Well, it has a slower, more gradual course that, like the Helicobacter, leads to chronic low-grade inflammation. This has a different immune factor involved with it. It's called IgG. G as in George, or G as in gradual. So that's an easy way to remember them. I have a story that's really worth telling here. I was asked to see a middle-aged man who's a corporate executive. He was actually dragged in by his wife, which, by the way, in my practice is not an uncommon scenario. And he came in because he was having some chest discomfort, and his wife was concerned he had heart disease. But when I started to question him, he was getting injections every month in his butt with an antibiotic and a steroid. And I said, I don't know of any medical condition that would warrant you having these injections every month. And he said to me, Dr. G, if I don't take those injections, my joints are so bad, I can't get out of bed in the morning. I can't even walk. He said, and then what happens? I get this horrible skin rash that everyone can see. He said, I can't go into a board meeting covered in a skin rash. So every month, I have these injections. Well, what we did with him was we decided to test him, to do a genetic test for gluten. I was so convinced he had gluten sensitivity. So I brought this up to him, and he said to me, there is no way. That can't be right. I'm not stopping my gluten. And I can tell you now, 6 years later, after stopping his gluten, not touching it again, he has no symptoms, no need for antibiotics, and he has absolutely no need for steroids. He is now a believer. And as I said earlier, this is so important, we'll spend a whole lecture on food sensitivity and food allergy. Let's go to another common cause of inflammation. I see this one also every day in my practice. It's midline weight. Just wearing your weight in the midline, because those fat cells are actually an inflammatory organ. They're an endocrine organ, and they produce all sorts of what we call cytokines. These cytokines raise our blood pressure, cause inflammation, make us diabetic. So just carrying that midline weight is a source of inflammation. Another big one is lack of sleep. If you have chronic sleep disturbance, or even just a few hours of lost sleep, the body says, turn on the defenses. We have a problem here. And that defense system leads to inflammation. And there's one that's really worth mentioning at this time, which is something called sleep apnea, or sleep-disordered breathing. People who snore and then stop breathing. This can also lead to chronic inflammation. It also leads to weight gain. And one of the most interesting articles to just come out this week has identified that lack of sleep results in people eating 500 more calories per day. And you might say, why? Why do people eat more calories if they don't sleep? Because they're using the food during the day to perk themselves up. If I eat sugar, I'll wake up. That's what people think. So far we've discussed some of the main causes of inflammation. There are some genetic causes as well, but the big ones we've already hit on. Environmental toxins, microorganisms, food sensitivity, carrying extra weight in the midline, and lack of sleep, or even sleep apnea. I mentioned very briefly stress. Stress is so important that we have more than one lecture dedicated to that topic alone. So now let's turn to the biggest category, food. You've already heard me say, what you eat can turn inflammation on. More importantly, what you eat can turn inflammation off. Let's take a quick look at the 8 major foods that contribute to inflammation. This is a big one, sugar. Sugar is probably number 1. And I know you're thinking, oh, but I eat brown sugar. No different. Sugar is the number 1 cause of inflammation, and it is so important. We have an entire lecture dedicated to it. No matter what name it hides under, and these are just a few: corn syrup, dextrose, fructose, golden syrup. Boy, that sounds like it's healthy. Maltose and sucrose. It is still sugar, and it leads to inflammation. Now, if you have any signs of inflammation or any problems linked to inflammation, like heart disease, memory loss, arthritis, just to name a few, the first thing I want you to do is eliminate sugar. As a matter of fact, I can't think of a good reason for you to be eating sugar right now. Refined white sugar. No good reason. Let's take a look at oils. I've mentioned oils in a previous lecture. So there are good oils that have a very good omega-6 to omega-3 ratio. And then there are oils that are very high in omega-6. I want you to stand clear of these oils. These include grapeseed oil, cottonseed oil, corn oil, safflower oil, and sunflower oil. These are industrial vegetable oils. They're usually in fast foods and they're in processed foods. So those oils we need to avoid. You will hear a common term called trans fats. Trans fats are a modified form of fat that do a lot of bad things. First of all, they increase our LDL, or our bad cholesterol. Even more importantly, they oxidize the LDL. And that oxidized LDL leads to the laying down of plaque in the vessel. They also lower the good cholesterol, what we call the HDL. Now, in the previous lecture, you heard me say, don't deep fry your foods. There's no reason to deep fry anything. Trans fats are found in deep fried foods, fast foods, commercially prepared baked goods. They're just added in. And they usually will appear on the label as partially hydrogenated oil. So when you look on your label, I want you to avoid trans fats. Well, you might be thinking, oh, I know all this. This makes sense. I've heard trans fats are bad. But the next one might surprise you. The next one that leads to inflammation is milk. That's right, milk, cow's milk. 60% of the world's population cannot digest milk. In fact, researchers think that being able to digest milk beyond infancy is actually abnormal. Now, a lot of people know, gee, I can't drink milk, I'm quote-unquote lactose intolerant. And what happens in that situation? They develop stomach distress, diarrhea, gas, bloating. What most people don't realize, milk is a common cause of arthritis and a common cause of skin rashes. Another big category, one of my favorite topics, and this is something I don't think most people have heard, is cured meats and red meat contain a substance called new 5-GC. This is a compound that the body sees again as a foreign invader, produces antibodies to it, and triggers an inflammatory response. So yes, red meat again, we saw it implicated in colon cancer, worse prognosis in ovarian cancer, intimately linked to heart disease. And now I'm telling you, one of the common bases for that is inflammation. The link between processed meat consumption and cancer is really strong. Commercially produced meats, animals living on feedlots, are fed soybeans and corn. Think about this for a second. Eating meat that's from an animal, which is high in omega-6, leads to inflammation. This is one of the things I tell my patients. Not only do you have to know what you're eating, but the crazy part about this is now you have to know what the animal ate, because what the animal ate can affect you. If the animal is given antibiotics, if the animal is given hormones, if the animal is eating omega-6, that's what you're getting. There's one other one that people don't want me to talk about. This is a favorite, alcohol. I'm not talking about moderate alcohol consumption. For women, 1 glass of wine 3 or 4 times a week, or 1 drink 3 or 4 times a week. For guys, 1 glass a night. I'm talking about excess alcohol consumption. It is rampant in our culture. I see couples come to me and they say, well, every night my husband and I drink a whole bottle of wine. Is that too much? The answer is yes. High consumption of alcohol is linked to irritation and inflammation of the food pipe, the esophagus. We know that esophageal cancer is linked to alcohol consumption. Larynx, the voice box, cancers linked to alcohol consumption. And I know you find no surprise when I tell you that it affects the liver as well, everything from cirrhosis to alcohol-induced hepatitis and so on. So over time, chronic inflammation from alcohol can lead to tumor progression. You have to remember, alcohol is a sugar. So if you're trying to keep your sugars down, you need to keep your alcohol down. We will spend an entire lecture talking about sugar and refined grains, white stuff, white bread, white rice. Let me just leave it at this right now. Don't eat anything white. If it's white, find something else. Maybe with the exception of cauliflower. That one I want you to eat. The last category we have to put up is artificial food additives. This is the last one we need to look at as it relates to inflammation. Things like monosodium glutamate, aspartame. These trigger the inflammatory response. So I think you know what I'm getting at. Don't buy anything in a package unless you can read the label really clearly and identify all of the ingredients. Again, go back to whole food items because you only find this stuff in packaged foods. One of the jokes I have with my patients is I say, you can go to the supermarket, but walk around the outside aisles, which basically puts them in the fruits and vegetable category. The minute you go into the middle of the supermarket where everything is packaged, you have to be like a detective. Well, that's the bad news. There's a lot of stuff out there, and this stuff can really make us sick. So what do? How do we put out the fire? And how can we use food as medicine? So let's start with food first. I've already talked to you about my whole foods, my love of whole foods. Well, no surprise. What do I want you to eat to prevent inflammation? Whole grains, all the whole foods we've talked about, the fish high in omega-3, remember SMASH? Real kelp. That's right, seaweed. Kelp, for example, is very anti-inflammatory. But don't go buy it in a package where it is covered with all sorts of processed chemicals. You have to get it fresh. Again, whole fruits and vegetables, broccoli, blueberries, papaya. We talked about our shiitake mushrooms. This is the first step. We also talked about oil. What oil do I want you to use? Of course, olive oil, avocado oil, macadamia nut oil. We're not going to be using corn oil. All of that leads to inflammation. One category we didn't hit on in previous lectures is a category that's near and dear to my heart, which is tea. You may remember that in the nutrition lecture on Not All Foods Are Created Equally, we talked about something called flavonoids. Flavonoids are phytonutrients. These phytonutrients have anti-inflammatory capacity. Now, tea is the second most consumed beverage in the world, next to water. So of course I want you to drink filtered water. Please don't drink your water from plastic bottles. It's not good for the environment, and as you will see in a later lecture, it's not good for you. So filtered water, that's number one. If you like tea, I want you to think about a few different teas. The first is black tea. Beautiful research on black tea shows that black tea dilates blood vessels. You probably remember I once showed you a steak, and that steak constricted the blood vessel after you ate it. Well, black tea has the opposite effect. It dilates the blood vessel. Another favorite tea is green tea. Buy some organic green tea. Like broccoli, like turmeric, like shiitake mushrooms, green tea can protect against cancer. It's anti-inflammatory. And as a matter of fact, a study came out of Japan showing that people who consume just 5 little cups of green tea a day, 5 little ones, have a marked reduction in cardiovascular disease. So my 2 favorite drinks are tea and water. One other tea worth mentioning is something called Tulsi. Tulsi is an Ayurvedic herb, comes from India. In India, Tulsi is considered the herb of the deities. It is pure anti-inflammatory, and there are beautiful organic teas on the market where you can have green tea and Tulsi together. To me, this is medicine. We will spend a lot of time talking about herbs in a separate lecture. When I prepare food, I like to think about what are the best kind of spices, because spices, when used right, have powerful anti-inflammatory components. Now, I travel to India quite a bit, sometimes 2 times a year, and that's where I got introduced to turmeric, because turmeric contains a powerful, non-toxic compound called curcumin. Actually, this is what makes mustard have a yellow color. Research studies have shown that turmeric is as good on occasion as hydrocortisone and Motrin for inflammation. So think about that. Powerful drugs that are used to treat inflammation, we can get similar benefits from adding a spice. I like to add the turmeric to everything. You can add it to your kale. You can put it on top of your kale. I add it sometimes to egg whites. I like it there. You can put it anywhere that you want. In India, they classically use it in the bean and lentil dishes. This is a common one. As you will see in the herbal medicine lecture, turmeric has anti-cancer properties. We even give our cancer patients turmeric 2 times a day to take. Now, the other great anti-inflammatory spice is ginger. Where might you think of using ginger? Well, you can put it in any food you like if you like the taste of ginger, but as you will hear about in the herbal medicine lecture, we commonly use ginger for pregnant moms. We don't want to give a pregnant mom a pharmaceutical drug. If they have nausea, you can bet 9 out of 10, or maybe 10 out of 10, holistic integrative physicians are going to recommend ginger. So ginger, like turmeric, has powerful anti-inflammatory benefits. It also has the added benefit of helping with nausea, with vomiting, not only related to cancer, but also related, and chemotherapy, but also related to pregnancy. Well, the list doesn't end there. There are a few more spices I like to use. You heard me mention Tulsi. Well, you can remember that Tulsi is also called holy basil. Basil in general, which is a staple in the Italian diet, is anti-inflammatory, as is rosemary. So if you like those, add them on. These are great spices that will decrease inflammation. So we have been talking a lot about the causes of inflammation, and we now know not to eat sugar. We know which oils we should use, which oils we should put aside. We have some good food choices, whole foods, green vegetables, beans, and lentils. We know which spices we can use. I can tell you this. It works. I have seen it time and time again in my patients. We already talked about my corporate executive who came in with arthritis, skin rashes, said he needed a shot of steroids and antibiotics every month so he can go to his board meetings. And we took him off of gluten, which was causing his inflammation in the first place. He had food sensitivity. But I've had other patients have equally as miraculous cures. This was one of my favorites. I saw a veterinarian in his 50s who came to me because he was having a heart arrhythmia, something called atrial fibrillation. This is where the heart beats not regularly, jumps all around. And usually when we see this, we give blood thinners like Coumadin, and we give medications, and today we have lots of surgical procedures. Well, he wasn't interested in any of that. So I said to him, tell me when your atrial fibrillation occurs. And so he began to keep a journal. And he would have episodes, maybe a minute, maybe 45 minutes, but invariably, they occurred when he ate sugar. So guess what? We had a simple treatment for his atrial fibrillation. I asked him to stop eating the sugar. And he said to me, why? I said, because we've already identified it as a problem for you, but it is also inflammatory, and that inflammation is affecting your heart. So at the end of the day, we have the power to put out the fire. If we just take these first steps, I promise you, you will send me an email and you will say, Dr. G, my arthritis is gone. Cleaned up my diet, got rid of the bad stuff. I no longer have pain. You will tell me that your energy is better, that you're sleeping better, and the list is endless. Welcome back. I always say that the greatest things I've learned have come from my patients. One weekend, I went to a holistic integrative medicine conference, and I heard about food sensitivity and food allergies. This is one of those areas that Western medicine doesn't teach very well. Never really learned about it in medical school. So I came back to work on Monday, and as luck would have it, a young woman showed up in my office. And she said, I don't really know why I'm here. My mother forced me to come see you. I'm getting married in 2 weeks, and I have to have sinus surgery. So I thought, this is going to be interesting. She said, I don't want to have the sinus surgery because I don't want it to interfere with my wedding pictures. Why was she having sinus surgery? Well, for the last year, she had been on antibiotics 6 times, a course of 10 days each time. She was living on antibiotics because of her sinuses. I said to her, you know what? I just heard some of the most amazing data as it relates to food and illness. I said, if I take you off of the common food allergens, would you be willing to do it? And we can see if we can impact your sinuses. And she said to me, yes. So I did. About 6 months later, she showed up in my office with a new last name, because now she was married. And I said to her, how are you doing? And she said to me, I'm cured. The most important lesson that we can learn from this person, my patient, is illness can be connected to food in ways that we never even thought about. Today's lecture will explore common food sensitivities and one very successful strategy for dealing with them, the elimination diet. Let's start with a few definitions. I mentioned in a previous lecture that there are two types of reactions. One is an allergic reaction. That happens quickly. This is a food allergy in which someone eats shellfish or they eat a peanut, and all of a sudden they can't breathe. The immune globulin, the protein responsible for this, is IgE. But food sensitivity is something different. You may not recognize it immediately. It's one of those causes of low-grade chronic inflammation, which we talked about. You keep taking in a food, and your body keeps seeing it as the enemy. It's that foreign invader. It's that toxin. And the body is working 24/7 to clear it from your system. Even though the reaction may not seem severe, meaning you have trouble breathing, the long-term consequences are enormous. So what are some of the signs and symptoms that we expect to see with food sensitivity? I see these again every day. Fatigue, trouble sleeping, mental fogginess. People who say to me, I can't focus and I lose my concentration. We can even see mood changes, irritability, anger. These are very common. And if you have any of these, I want you to start writing them down. Think about what I'm saying, because although this program may not be for everyone, if you have any of these symptoms or signs, this may be just what you need. Skin irritation, rashes. Oh, I have eczema. Oh, I have psoriasis. All of these have been linked to food sensitivity. What about something as simple as arthritis? Joint pain. I mentioned in a previous lecture that the casein, the protein in milk, cow's milk, can cause arthritis. It's not just about gas and bloating. Muscle stiffness. You may have gas and bloating. You may have what we call irritable bowel syndrome. Diarrhea one day, constipation the next. And remember that patient that had the sinusitis? What did she have? She had nasal congestion, postnasal drip, sinus infection, ear infections. She had all of those, and they were related to food sensitivity. So, if you have any of these signs and symptoms, there is a good chance that you have food sensitivity. More importantly, research has shown that your symptoms are most likely connected to 6 common groups. These include dairy, number 1, gluten, number 2, number 3 is corn, number 4 is soy, number 5, peanuts, and number 6, egg. These are the 6 common food sensitivity items that we see. So how do we determine if your symptoms are coming from one of these 6 foods? Well, there's a tried and true method. It's called the elimination diet. The elimination diet is a dietary program which is designed to clear your body of foods that you may be allergic or sensitive to. When we get into the protocol, we will ask you to stick with the diet without exception for 2 weeks. Now, the tricky part to this is to not eat the foods whole or as ingredients in other food. What do I mean by that? Well, many people say to me, oh, I can give up dairy. I don't drink much milk. And then I say, well, it's also in pizza cheese. And I see a sad face. Come on. Dairy is also whey, casein, lactose. So when we talk about eliminating a group, we eliminate it in its entirety. And you may be thinking, gee, I don't know if I can figure this all out. Well, there are certainly great websites to help you. And definitely eating out during this time can be a challenge. But what I do with my patients is I have them sit with a nutrition expert who really understands the elimination diet. And we are able to walk my patients right through with what to eat and what not to eat. So how do we do this? Where do we begin? Well, let's say you're really suffering with arthritis, or you have really bad irritable bowel syndrome. I want you to do this program right from the beginning by eliminating all 6 food irritants. So on day 1, we begin the elimination diet. And before you start, of course, you want to have from your nutritionist the foods you can and cannot eat just to help you out. And you want to have the right foods in your house. You want to be ready. Now, between day 2 and day 7, you may start to feel like your symptoms are getting worse. You may say, wow, my arthritis is a little worse. Or all of a sudden, my skin rash has come back out. This is what we expect. As you clear your body of the toxins, sometimes they flare up. In traditional Chinese medicine, we call this a healing crisis. It is part of the healing. By about day 8, and somewhere between day 8 and day 14, the symptoms should resolve. They should disappear. If they do, then we know we've hit a home run. One of these 6 food groups is causing your symptoms. So now the big question is, which food is it? I just gave up soy. I gave up dairy. I gave up gluten. I gave up corn. I gave up eggs. I gave up peanuts. I gave up all 6. I feel great, but which one is it? So, on day 15, we want you to reintroduce one of those foods. For example, dairy. Have some dairy in the morning, small amount in the AM. Have it again for lunch, and have a small amount for dinner. And then stop. Stop the dairy after that day. And now we wait. We wait and see what our body does with reintroducing this food. So on day 16 and 17, we wait for the body's reaction. What do I expect to hear from my patients? Frequently at this time, people will say, oh, I ate the ice cream and my sinusitis, my sinuses flared up. I knew right away it was ice cream. I knew it was dairy. So this is how we do it. By day 18, we are ready to reintroduce the second food. Let's say the second food is gluten. So now we reintroduce the gluten. And we do the same thing. Small amount in the morning and a little bit more in the afternoon and later in the day. And this process will go on until we get through all 6 food groups. So let's review. We clean everything out of the diet that we discussed for 2 weeks. We reintroduce them one at a time. We reintroduce a food and we wait for 2 days to see the response. And then we don't keep that food in our diet. We keep it out until the elimination diet is over. This helps us to identify which foods we are sensitive to, and many of us are sensitive to more than one food. I have to take a minute to share my own story. I am a milk baby. I love milk. I've loved it my entire life, as a kid and as an adult. I can drink a quart of milk a day. And I would always have organic, fat-free milk. And I all of a sudden began to get arthritis. And I thought, this is bizarre. My joints are hurting. So when I did the elimination diet, I found it was related to dairy. Stopping the dairy stopped the inflammation in my joints. I don't say I like it, but I really like not having joint pain. And I have substitutes for my dairy, which we'll talk about later on. So again, remember, introduce one food for one day, and then do not reintroduce it back into your diet until you complete going through all 6 foods. Now, I bet some of you are saying, this is too much. I don't think I can do this. Seems too intense. Well, there's a little shortcut that I use with some of my patients, and I'm going to tell it to you. If my patient says, I always have flare-ups of my sinuses, I have postnasal drip, like the lady I presented in the beginning, already the bells are going off to me as a physician. She's got a sensitivity to dairy. That's number 1. So when I hear about sinus congestion and gas and bloating in the abdomen, I'm usually targeting dairy. The other big one is gluten. And so if you can just do the 2 most common allergens, eliminate those 2 for 2 weeks. Dairy, including all milk, cream, cheese, cottage cheese, yogurt, butter, ice cream, frozen yogurt. You have to look where it is, and it's added into a lot of things. The same with gluten. Wheat, spelt, oats, rye, barley, malt. You have to get the lists, and you have to take those out. Those 2, for many people, solve the problem. But some people do have other food sensitivities, as we mentioned. Now that we have some of the basics, let's take a look at some of the research, because this may seem like it's not for real. It may seem like it's too simple or it's impossible. But there is strong evidence to support what I'm saying. I like this study that appeared in The Lancet in 1979. It looked at people who were having migraine headaches on a routine basis. For those of you who have migraine, I want you to really think about the elimination diet. Because what this study showed was that 78% of the people who suffered from migraine had a sensitivity to wheat. That's where the gluten comes in. Other sensitivities were also identified, like egg, 45%. For some, it was milk, 37%. And then there were a few others. Some people were actually sensitive to oranges, to citrus, some to beef. Corn even came up over 30% of the time. What sold me on this study was when you looked at the number of headaches that people had. On average, for the whole group, they had 402 headaches per month. For those of you who have migraines, this is a crippling phenomenon. Those people who identified the foods they were sensitive to, who did the elimination diet, their headaches fell as a group from 402 to 6 per month. That's huge, 402 to 6. 85% of the people in this study became headache-free. That, to me, is powerful medicine. What about people who have irritable bowel syndrome? This is common. I have gas, I have bloating. We've talked about this. Well, they did a very similar study, and this appeared in the Lancet. Basically, what they did was place people on the elimination diet and then looked for the foods that were the triggers for their symptoms. What they found was this. Number 1 was wheat, corn, dairy. Again, we see those common culprits coming up, those common foreign invaders, if you might, that trigger the entire inflammatory response. Coming off the foods, resolution of symptoms. Well, I know you think this may be a little complicated. And as I told my patient, and she had 2 weeks to get married, I said, I'm going to give you some quick substitutions that you can do right now to replace the common food sensitivity or food allergens. So when I told her to come off of dairy, I said, you have lots of options. Have rice milk. Have coconut milk. Have almond milk. I didn't give her soy milk because remember, we said soy can be a very common food sensitivity item. She said, I like rice milk, and that's what she drank. A little bit more complicated than that is the non-gluten grains. But once we learn what they are, it really is pretty easy. I'll just give you my 2 favorites, brown rice and quinoa. There are others, buckwheat, arrowroot, for example, millet. But most people feel pretty good just working with the brown rice and the quinoa. Now you may notice when you go to buy gluten-free products, and there are many today on the market, some are made with potato flour. That's not my favorite. My favorite ones are made with organic brown rice. So if you want to bake, if you want to make breads, what would you use? Well, you certainly can go and buy a gluten-free bread, like one made from organic brown rice. You can use rice flour for baking. You can use quinoa flour. You can use potato flour, but again, because, remember, potato is white, it's not my favorite item. Amaranth, you can even use garbanzo bean. Now that's a surprise. You can use arrowroot. You can use rice bran. So we have some good options. Again, for me, quinoa and organic brown rice being a favorite. If you like a nice warm cereal in the morning, like an oatmeal, well, you can get a gluten-free variation on that. And they are quite good. You can also have cream of rice, if you like that. Instead of having wheat flakes, you can have puffed rice. You can have quinoa flakes. If you decide, gee, I want a bowl of pasta, well, it doesn't have to be wheat pasta. It can be rice pasta, for example. And I also like to get those little rice crackers. They have hardly any calories. They're made organic. You can eat 10 and you don't even get 100 calories, and they taste really good. So rice crackers are a good option. So remember, when you're substituting for dairy, think about nuts and think, what kind of milk-type products can I get that come from the nut? And my favorite here is almond milk, but you can also get coconut milk and you can get rice milk. All of these are readily available in any supermarket, easy to buy. Again, I like to buy them organic whenever possible, especially the almond milk. The other 4 items on our list are easier to avoid, but I have to mention that they're frequently hidden in things. If I tell you not to eat corn, you know not to eat corn. Soy is a little bit trickier because there are very numbers of vegetarian meats, lots of them on the market, that have soy in them. Soy is also in soy sauce, tofu, and miso. Soy is added to a lot of things. So again, you want to read your labels and you want to read them carefully. Eggs, another added ingredient sometimes. So you have to look at the label. And peanuts. So corn, soy, eggs, and peanuts, those are the other 4 we want you to avoid. I had something happen to me on Christmas Eve. I had a friend come to visit, and she's a chef. She's written a number of cookbooks, and I was thrilled to have her help cook. That was a good thing. And I wasn't thinking. I lost my guard. I let my guard down. She made a spinach dish. I love spinach. I ate a big portion of the spinach dish. And when my stomach began to act up, I realized, and I said to her, "Did you put cream in the spinach?" And she said, "I made it with cream." And I thought, no wonder I'm having this problem. So remember, no creamed vegetables and no corn added to the vegetables. So if you have a mixed vegetable, it cannot have corn in it. Sometimes we forget. There are a few other pitfalls worth watching out for. If you tend to use baking powder, for example, it frequently has cornstarch in it. All of those products that are on the market that say high fructose corn syrup, I don't want you to eat those anyway. I mean, I don't want you to eat anything that has high fructose corn syrup, but just remember, that's corn. And then one that I didn't think about was vinegar, because the vinegar that we have in condiments like ketchup and mayonnaise and mustard frequently comes from wheat or corn. So we have to be detectives. And again, this goes back to working with a nutritionist. It's really helpful here. So we need to read our food labels super carefully. Some breads are advertised as gluten-free, yet they contain oats and spelt and rye. You want to make sure, even if you were someone who ate tuna fish, for example, that it didn't have a soy filler in the tuna. This is common. If you see the word multi-grain on a product, it's usually got a mixture of things. So for example, multi-grain rice cakes, there's a good chance that they have gluten. Rice cakes are not my favorite food because they are white. But for the 2 weeks of the elimination diet, if you need them for a snack, that's okay. I really prefer the pure rice crackers myself. So let's go through some tips.